Good afternoon. Our second slide for Unit 2, or second slideshow for Unit 2, excuse me, is all about the transmission of diseases. So here we go. A disease is a deviation from the normal health or production of an animal. The types of disease and the severity of them are based upon transmission, type of pathogen, and the prevalence of the disease. Diseases can be acute, which means they are short-lived, or chronic, which are occurring slowly over a long period of time and are based upon the effect that it has on the animal. Diseases are broken down into 4 different categories based on the cause of the disease. So here we go. And the first type, an infectious disease, is usually caused by a pathogen. It can either be contagious or non-contagious based on whether or not it can be transmitted from the source to the host. The second type are non-infectious diseases, and they can be caused by things like genetics, maybe a traumatic accident, or iatrogenic diseases. Iatrogenic is a funny word, it's tough to pronounce, but in some cases, iatrogenic are those diseases which can be caused by the treatment itself. So when you give somebody radiation to help treat their cancer, believe it or not, a secondary cancer can form as a cause of the radiation, and so that would be an iatrogenic type of cancer. The fourth category then are idiopathic diseases. They're called idiopathic because, in all honesty, these are diseases where the cause just isn't known. So as you can see on the slide here, it says seizures is one of those diseases. An animal can have seizures for a lot of different reasons, and we often don't know what they are. So diseases fall into 2 major categories then as to the cause or the type of disease it is. Those diseases can either be contagious or non-contagious. If it's contagious, this disease can be spread from one animal to another. An example would be cryptosporidiosis, otherwise known as crypto. This is a disease that lives in the intestines of humans and animals and is passed on in the stool of an infected person or animal. Chlamydiosis is one of several common asymptomatic sexually transmitted diseases. So if you're breeding animals within a herd, they could actually transmit chlamydiosis from one animal to another. A non-contagious disease is anything that can't be spread to another animals. For example, mastitis. When dairy cows get mastitis or a bacterial infection inside their udder, the milk kind of comes out looking like bloody cottage cheese. The good news is that is not transmittable from one dairy cow to another. So mostly that milk is withdrawn from the milk tank and nobody gets to use that. Oral yeast infections are those that are in the mouth. Typically that doesn't get spread from one person to another. So transmission of disease can occur in both direct contact and indirect contact. Direct contact occurs when the host comes in contact with the infected animal's skin or mucous membranes. This occurs through vectors, which like sexual contact, contact with blood, or one animal sneezing or coughing directly on another. Or vertical transmission, which is actually from a parent to its offspring. Indirect transmission occurs when the host comes in contact with an intermediate conveyor, whether it be a fornite in food or in the air. A fomite in medicine is an inanimate object or substance, such as clothing, furniture, or soap, that is capable of transmitting infectious organisms from one individual to another. Sometimes an animal can become infected with nosocomial infections, in which case the animal acquired the infection while it was at the hospital. Nosocomial means that originating or taking place in a hospital, acquired in a hospital, especially in reference to an infection. Methicillin-resistant Staphylococcus aureus, MSRA, is a type of staph bacteria that is resistant to certain antibiotics and may be acquired during hospitalization. So we use a couple of different terms to talk about the severity of a disease and its prevalence within the disease. So we actually talk about those three levels as endemic, epidemic, and pandemic. Endemic diseases are identified as steady, ongoing presence of a disease within a population. This normally occurs due to the presence of a reservoir within a particular location. For example, tick-borne diseases, such as Lyme disease, are endemic within the United States based upon the presence of the deer tick. Now, that's just within the deer population. When an endemic disease suddenly reaches beyond the expected population, then the disease is categorized as epidemic or outbreak. Finally, a true crisis occurs when an epidemic occurs across continents, causing a pandemic, such as avian influenza or swine flu. Diseases like that is ultimately the goal of all people concerned in both human medicine and veterinary medicine, to prevent pandemic diseases from happening. So there you go. We now have talked about the various modes of transmission of common diseases. Thanks for listening.